Today we're going to talk about potatoes. Since I started eating whole food, plant-based about 3 years ago, potatoes have become a very important part of my diet, along with beans, brown rice, green leafy vegetables, but I would say potatoes are probably my favorite food. And I'm going to show you a few different ways that I prepare them so that you can maybe try some of this at home. But first, a lot of people say to me, well, that's a lot of carbs. You can't lose weight if you're eating a lot of carbs. And I know that's not true because I've lost 60 pounds eating an 80% carb diet, 10% fat, and 10% protein. And I feel great. I feel better than when I was in my 40s and 50s. And so I know that our body runs on carbs. It gets turned into glycogen when we eat it, and then our body produces insulin. And the insulin first takes it to the liver, but because we're eating all this fatty animal products, and the saturated fat from animals is in all the products, cheese, meat, milk, any kind of dairy. So I've cut all of that out. And when you cut out all that animal saturated fat out of your diet, your body responds to carbs better because you become more insulin sensitive. Your body listens to the insulin and accepts the glycogen into the cells. But when you've got all the animal fat in you, saturated fat, it fills up your cells. It goes to your liver first, fills up your liver, you get fatty liver. Then it goes to your muscle cells and fills your muscle cells full of fat. And then it goes to your other cells and fills them full. And when you eat a banana, your body turns it into glycogen and then produces insulin. And the insulin attaches to the glycogen and takes it to the liver first. The liver says, no, we're full of fat. We can't accept anything else. Then it goes to the muscle cells. And the muscle cells, no, we can't use that right now. We're so full of fat, we can't store anything else. Then it goes to your other cells and they say, we're full of fat, we can't take any more to store it. So the glycogen stays in your blood system, and all of a sudden now everybody says, oh, it spikes my blood and I can't eat carbs. Well, the problem isn't carbs. The problem is that you've eaten so many animal saturated fats that your insulin can't get the glycogen into your liver, into your muscles, into your other cells to store it to use as energy later. And so it stays in your blood, and now all of a sudden people go on metformin because they've filled up all of their cells full of fat, and they're insulin insensitive. They don't listen to the insulin when it's trying to bring glycogen to the cells. So as you cut those animal products out of your life, out of your diet, your body becomes more insulin sensitive, and you're able to store carbs and use the glycogen. That's why I have so much energy, is that I'm not filling my body full of all these saturated fats. I don't even eat a lot of oil. I try not to eat deep fried chips. I try to eat baked chips. I don't fry with even olive oil or coconut oil. No oils, because they're all processed. So the closer you can get to whole food, plant-based, the healthier you're going to be. And the better you're going to sleep, the easier it is for you to exercise. So all these things come into play. So I'd like to show you some of the ways that I prepare potatoes, because that's, for me, a very important part of cutting out animal products, is having something really fun to eat instead of them. And the great thing about these potatoes is they have a lot of fiber and a lot of bulk and very little calories. Whereas with meat and dairy are high in calories and no fiber. And our microbiome, our good bacteria, it wants fiber and it wants resistant starch. And both of these products are in potatoes. We're going to talk about resistant starch and fiber. And so potatoes are one of the most filling foods you can eat. In fact, if you ate 3 cups of potatoes, it would be about 300 calories, about 100 calories per cup. I mean, try and eat 3 cups of potatoes. It's hard, it's very filling. So, you know, I've never been hungry, I've never counted a calorie, and yet I've been able to lose 60 pounds and maintain my weight now for 2 or 3 years. So the first thing that I start with is sweet potatoes. Now, sweet potatoes, I had never had a sweet potato other than Christmas and Thanksgiving with marshmallows and brown sugar and butter. I'd never had a sweet potato just as a sweet potato in my life. And so when I discovered them, I was like amazed at how sweet they are. So one of the secrets about sweet potatoes is I boil my sweet potatoes, even and my russet, any of my potatoes, any of my starch. I steam it first, and then I put it in the refrigerator in like this glass bowl here, and I leave it in overnight, or at least 6 or 8 hours, and then I bake it at 500 degrees for 30 minutes. And you can see that it gets the pan all gooey with the syrup that comes out of it. Sweet potatoes are naturally sweet. They don't need anything. So these, I've got 3 different kinds of potatoes here. I've got the regular orange that you'll recognize, kind of the orange inside and out, sweet potato. I've got this white one, which is white inside and out. And I've got this red one that has a white inside. Now there's like 20 different types of sweet potatoes or more. I don't know how many differences there are, but there's a lot of them. The dark blue ones, I don't have any, or dark purple, are really good for you. I don't have any of those here today, but those are a great potato to eat. Get a variety of potatoes. These are the golden yellow potatoes. I'm going to show you how I fix them in a minute. So I first steamed these in my steamer pan. Then I put them in this glass pan and put it in the refrigerator overnight. Then the next morning I put them in the oven at 500 degrees for 30 minutes. And that's what gets all that syrup out of them. So now they've been steamed or boiled. You don't have to steam them, you can boil them. And then they've been baked. And now what I do is I slice them and I put them on this pan that is like a cookie sheet with a like a cooling rack inside it. And I happen to have a convection oven. I didn't know that a convection oven really is the same thing as an air fryer. So I was thinking about buying an air fryer, and then I found out, well, a convection oven does the exact same thing as an air fryer. So the reason I put them on this cooking rack is that when I put it in my convection oven, it moves the air around both sides and cooks both sides of these potatoes at the same time. So I like my slices kind of thick. Brenda likes her slices thin, almost like a potato chip. Whoops, it kind of fell apart there. Try another one. So she likes hers thin and crispy. Okay, so I'm gonna now put this pan, all these sweet potatoes, I don't put anything on them. Salt, pepper, nothing. Put it in the oven for 30 minutes at 500 degrees. Along with these golden yellow potatoes. And what I do with those is I slice them in half, and then I make little wedges out of them. And then I put them in a pan like this, and I pour a little water over them, and then drain the water. And then I pour some oat flour and nutritional yeast in the bowl, and I shake it around, and then I put them on the pan like this. Now, there's usually a little leftover flour and nutritional yeast in there. I'll pour on top of them. So I use salt on them. Some people may want to, some people may not want to. That's individual. And I'll put a little pepper on them. Again, that's your choice. And then the nutritional yeast that I use is Bragg's nutritional yeast. It says, specifically designed to help meet the nutritional needs of vegetarians and vegans and anyone wanting an excellent source of thiamine, riboflavin, niacin, folic acid, and vitamins B6 and B12. So this is a really good food for you, a little additive. I'll take it and pour it right on the golden yellow potatoes. Again, I don't put anything on my sweet potatoes. I'll put this in the oven for 30 minutes and it'll come out just a little bit brown, a little crisp. I'm telling you, you will love this. So I'll be right back. I've cleaned up here a bit, and while we're waiting for the potatoes to finish cooking, let's listen to a talk by Dr. John McDougall, who's one of my mentors, and taught me how important it is for us to eat starch and not be afraid of carbohydrates. I think you'll enjoy it.
So we're going to take a trip through the gastrointestinal tract together. And the first thing I have to establish with you is the fact that the gastrointestinal tract is outside of the body. Not inside of the body, it's outside the body. The reason you need to know that is because it helps you understand the intimate contact and the immediate contact we have with this world around us known as food. Now, I think the best way to imagine this is think about an inner tube. If you think about a rubber inner tube, what you notice is that the surfaces that are toward the center are really outside the inner tube. And the way you really get into the inner tube is you have to put a hole through the rubber to get inside. Now, what if you took that inner tube and you stretched it out 30 feet? Still, those surfaces that are more toward the center would be outside, wouldn't they? And so it is with the gastrointestinal tract, all the way from your mouth to the other end. That's really outside the body. And to get inside the body, you have to pierce the intestinal tract and go into the bloodstream, into the body. Now, it's important for you to know this because when you put food into your intestinal tract, the contact is immediate and it's intimate. Maybe you can think about it this way. Just imagine taking and turning somebody inside out and rolling them down a hill. So their intestinal tract picked up all the grass and dirt and other stuff that's on the hill, and you could see the immediate contact. And so you'll see this in your health too. When you change your diet, one of the first things that will happen is this intestinal tract will become very content. The aches and pains, the indigestion that you had, the malfunctions you had with your function of your bowels, they will immediately disappear. And I have to warn you, when you decide for one reason or another, and hopefully this doesn't come up very often, when you decide that you're going to go out and have yourself a little feast meal, plan on McDougall's revenge. The effects will be within minutes to hours. You'll know why you eat well. I'm going to divide the intestinal tract, just for organization, into three general areas. We're going to talk about the upper intestinal tract, which is from the mouth down to the stomach. We'll talk about the middle intestinal tract, which is primarily the small intestine, and then the lower part of the intestinal tract, which is the large intestine. Just artificially, I divide it this way just to organize it so you don't get overwhelmed with this whole journey that we're going to take. The beginning of the gastrointestinal tract is the mouth. And the mouth is an obvious place where people have disease problems. And dentists know the connection between food and dental health. Dentists have been telling you all along, don't eat that bad food, particularly don't eat sugar because it will rot your teeth. It's really a lot more than sugar. It's the whole diet that will cause you to have bad dental health and rotten teeth. And it goes further. It also goes to the gums, not just the teeth. The health of the gums is determined by what you eat. And you can actually cure serious gum disease by changing your diet and getting good dental hygiene. Like starting to floss like you're supposed to and seeing the dental hygienist frequently. You can change 6mm pockets into 2 or 3mm pockets in just a matter of a few weeks by changing your diet and getting this good kind of dental hygiene. Now the mouth, as far as I'm concerned, is a window to the health of the rest of your body. I learned this actually when I was very young. My father, who lived on a farm when he was a little boy, he would tell me that when they went shopping for horses, that the way they determined whether or not they were getting a good horse, a healthy horse, is they'd look at the horse's mouth, look at the teeth and gums. And so when I examine patients, if you ever become one of my patients, one of the first things that I do when I examine you is I look in your mouth. And what I see is generally a reflection of what I'm going to see on the rest of the examination. Now, not only do you have the problems of bad teeth, bad gums, or healthy teeth and healthy gums as a result of how you take good care of yourself, but there's something else that comes out of the mouth that really is important to you. It's a part of your personal appearance, just as important to you as what those teeth look like when you smile. And that part of the personal appearance to you that is reflected in what you eat is how you smell. Smell is very important. Smell is a form of communication between people. The perfume industry knows this. As a matter of fact, we associate smell with love and sexual desires. And how we feel about people is communicated with the smells that we have between each other. As a matter of fact, when you study the anatomy of the brain, what you find is that the olfactory lobes, which are the connection to your nose, they dive directly into the hippocampus, which is the area of the brain that determines emotion, particularly love and sexual emotion. So there's this direct connection. So you want your personal appearance to reflect very positive things in terms of smell. And what you eat determines how you smell. You may have noticed this in various people that you've come across with. You may notice the spices that they consume. Garlic, of course, is an obvious one that you might notice. There are stories about Eskimos, people who have written about Eskimos and visited and lived with Eskimos about how they smell like fish. And I've heard stories of people who were in the Vietnam War who would talk about how the Vietnamese soldiers could smell the American soldiers when they got downwind because of the dairy and the meat that they consumed. So what you eat determines your body odor, which is very important to your appearance and your attractiveness to other people. And out of that mouth comes body odor. And that body odor is called halitosis, or bad breath. About half the people notice that they have really bad breath, and it's really offensive to them and worries them terribly. Dentists get involved with this bad breath issue. They often will measure the breath, and they take and measure the amount of sulfur coming out of the breath with a meter that they have in their office, and that will give a reflection of what the problem is, because really the real foul odors that come out of the breath are related to sulfur, just like rotten eggs. Now, dentists don't know where that sulfur comes from. Oh, they sometimes say it occurs because bacteria are living around the teeth and they make some extra sulfur out of whatever, the tissues. Well, they can't make actually extra sulfur because sulfur is an element. It is neither created or destroyed. So it must come from someplace. And very few people have asked, where does that stinking, egg-smelling, foul breath sulfur come from? Well, it comes from the food. And one of the things I shared with you and want to reinforce is that the sulfur comes from sulfur-containing amino acids that are in the diet that you eat. And so you can choose whether you eat a large amount of sulfur, which is going to come out of your breath and other parts of your body, or a small amount of sulfur by the foods that you choose at the dinner table. For example, beef has 4 times more sulfur-containing amino acids. Specifically, we're talking about methionine, one of the sulfur-containing amino acids, 4 times more than beans, and you have the same amount of protein in beef as you do beans. For the same number of calories, eggs has 4 times more sulfur than corn. And cheddar cheese 5 times more than white potatoes. Chicken provides 7 times more stinking, rotten smelling sulfur than does rice. And tuna fish 12 times more than sweet potatoes. So if you want to start becoming more attractive to those around you, and you want to start smelling better and get rid of that egg-smelling sulfur that comes out of your mouth, then what you need to do is choose healthier foods. Now at our clinic, in the McDougall program, we have actually measured the sulfur content of our patients when they come in, and we measure them 7 days later. And in just 7 days, we cut the amount of sulfur in their breath in half. Let's continue our trip through the gastrointestinal tract. From the mouth to the stomach is a very strong tube. It's called the esophagus. The esophagus rarely gets into trouble. It's mostly muscular. You swallow the food, it passes through peristaltic movements. What happens is it rhythmically contracts, and the food is pushed down into the stomach. Even if you're standing on your head, it'll push the food down into your stomach. And the esophagus rarely gets into trouble unless the stomach acids end up going back up into the esophagus. And this can happen. The way it happens is there's a sphincter at the bottom of the esophagus. It's called the lower esophageal sphincter. And this lower esophageal sphincter, it closes down. It's actually just muscles mainly that are supported by other tissues. It closes down completely between meals. And then when you eat and you swallow food, this sphincter relaxes and lets the food pass through into the stomach. And that's the way it's supposed to work. But what happens in people, because they eat an unhealthy diet for many years, and I'll explain to you exactly how it happens in a little bit. What happens is that sphincter, that lower esophageal valve that's supposed to be closed, becomes incompetent. And as a result, we get reflux of stomach contents, in particular acid, up into the esophagus. And you know about this. Why do you know about this gastroesophageal reflux disease called GERD? Thanks to the drug companies, right? They're teaching you about GERD, and they tell you the way to deal with this problem, this reflux problem, is to buy their antacid pill. Well, that certainly is one way, but there's a better way to deal with it, and we'll talk about that. So what happens is, if you have a diseased, an incompetent sphincter, is between meals, acid refluxes up into your esophagus. And it gets particularly bad when you bend over, for example. Now, when acid gets up into the esophagus, it can cause some problems. It can burn the lower part of the esophagus, and you get esophagitis. And it can burn it really bad over years of time, and it causes Barrett's esophagitis, and the lower esophagus looks like a piece of hamburger, raw hamburger. And then you continue to irritate that esophagus with those reflux stomach contents, particularly the acid that burns so much, and eventually in some people it turns into adenocarcinoma, cancer. And you don't want that to happen. That's a very difficult cancer to treat. Now when that acid refluxes up further into the esophagus, it gets into the back of the mouth, into the throat. Gets on your vocal cords and causes them to become irritated. You become hoarse. You have chronic cough. Can actually irritate them so bad that they may get cancer also. It gets on your teeth and it takes the enamel off your teeth. It gets into your sinuses and causes you sinusitis. And then you inhale that acid that is refluxed up into your mouth. You inhale it into your lungs, and it burns the lungs. It burns the airway tubes, called the bronchial tubes, and you get asthma. And eventually you can get emphysema as a result of that chronic acid irritation. So this is very important. You don't want this to happen. You want the acid to stay in the stomach. So how do you deal with this? Well, the way you keep the acid in the stomach is, first of all, you make less acid. So what makes acid? Well, acid is made in the stomach primarily to digest high-protein foods. So when you give up the meats and the dairy products, what happens is you decrease the acid production in the stomach. Now, you may have heard that eating dairy products would be good to quiet down the stomach and to neutralize the acid. That's not the case. Actually, the protein and the calcium in dairy products both stimulate acid production. And in studies, old studies and more recent studies where they've tried to heal ulcer disease giving dairy products, what they found is just the opposite. So there's some things you can do to help with that acid in the stomach to relieve the indigestion and help prevent that gastroesophageal reflux that is so distressing. Now the stomach does get into a lot of trouble, and it gets into trouble because the stomach is a vat. It's a vat that holds your food for a while, so it sits there for a while, so it has a lot of time to be affected by what you eat. And so you want to put good things in that vat to make it healthy. Now I was taught the reason that you have stomach trouble when I was a young doctor, I was taught that it was due to stress. And stress caused too much acid production, so what you needed to do is maybe go in and cut the nerves that cause acid production, or you need to take tranquilizers. These days what they teach is the reason you get stomach trouble is because you've got an infection of the stomach with a bacteria called Helicobacter pylori, or H. pylori. Now there is some truth to this. If you have that kind of infection and you have ulcers and you give somebody triple therapy, we call it, which is 2 antibiotics and a very powerful antacid, you will cure those ulcers. You maybe do other positive things to the stomach too. You may even reduce the risk of the stomach getting cancer, maybe. But what you don't do is you do not relieve the indigestion with this kind of therapy. These bacteria, they believe, are the cause of the problem. I don't. Well, sort of I do, sort of I don't. Let me expand upon that. Helicobacteria infect about 40% of the population of a developed country like the United States. Helicobacteria infect essentially 100% of people in underdeveloped countries. But in underdeveloped countries, they have very little trouble with indigestion or ulcer disease. So I believe these helicobacteria really only cause you problems if, along with it, you eat an unhealthy diet. Eating more fruits and vegetables, by the way, will cause less of those bacteria to grow. It inhibits their growth. And if you go through that triple therapy and you happen to get cured of your ulcers, what happens? A few weeks later, a few months later, you come in contact with that bacteria again and you catch it right back. Doesn't sound like a permanent solution to me. This is a bacteria that's spread by contact. So you're just going to get it back. The way you're going to solve the indigestion, the ulcer problems permanently is to start putting good things in the stomach. You may want some temporary relief from antibiotic or antacid therapy, but you really want to get to the cause of the problem. You really want to deal with the stuff that's in the stomach. But I have to say, that's one of the last things most doctors or even dietitians think about. How in the world could what you put in your stomach affect its health? You know, what a novel thought. It would be as silly as somebody saying, well, how in the world could smoking cigarettes give you lung damage? Well, it's so obvious, I guess people miss such things like that. And so what you put in your intestinal tract should be the first thing, not the last. Shouldn't be tranquilizers or some psychiatric illness that you focus on or stress in your life. It should be what you put in your mouth that determines the health of the intestinal tract. And if you think that way, you'll solve the problem in almost every case. Now, as you leave the stomach, what we do is we go into the first part of the small intestine, which is called the duodenum. And to the duodenum is attached the liver and the pancreas. The liver is a very important organ. It is the detoxifying organ of the body. What happens is if you take drugs, I'm talking about prescription, any kind of drugs, those drugs, they will go into your intestinal tract, and the first thing they do is they drain from the intestinal tract through the venous system and go right to the liver. And the liver takes most of that drug out of the system. If you even get drugs through your skin, the liver eventually takes those drugs or environmental contaminants or chemicals out of your system. That's what the liver does. Even things that your own body makes that are toxins, breakdown products, the liver takes those things out. So it's the big detoxifying organ. So it takes things out of the bloodstream, filters the body from all these contaminants, and it takes and puts them into the bile. The bile is the fluid in the liver that comes out of the liver. Well, the bile does something else too. The bile contains bile acids that the liver makes. The job of bile acids is to digest the fat in your food. Now, those bile acids are very important for you to know about. They digest the fat in the food. So you've got waste products, you've got bile acids that go to form this bile. Well, the bile drips out of the liver through various ducts, and then it forms a common bile duct. And off the common bile duct is a divergent duct that goes up to the gallbladder. The gallbladder is a sac that is there to store the bile between meals. There's no reason to have bile acid to digest fat in your food when you're not eating. And so what happens is you make this bile, and there's a little sphincter at the end of the common bile duct, just as it goes into the small intestinal tract, a little sphincter. His name is Odie. And he closes down between meals, and he pushes that bile back up, and it backs up into the gallbladder, and that's where the bile is stored between your meals. Now, when you eat, what happens is Odie relaxes, and the gallbladder contracts, and the bile is squirted onto your food, and it mixes up with the food. And that's the way everything's supposed to work. But people run into problems with the gallbladder. The major problem they run into is the gallbladder gets sick. You get gallbladder disease. And what you may know most commonly about that gallbladder disease is it gets stones. And we call those gallstones. And gallstones are really common in our society. Well, the hallmark of gallstone formation is supersaturation of the bile with cholesterol. Everybody knows this. Every doctor, every scientist, there's no disagreement. So you hear those words, supersaturation of the bile with cholesterol. Do you think you could figure out where this comes from? Remember, cholesterol is only from animal products. It's the American diet, rich in fats, animal products, even polyunsaturated, those vegetable fats, contribute to this problem because they concentrate that cholesterol in the gallbladder. So that's how you get the stones. Over 95% of the stones that are found in people who live in Western countries are made primarily of cholesterol. Okay, so you got gallstones and they start hurting. Now what do? You're in a whole different category. Now they're not asymptomatic, you actually have symptoms. The time-honored treatment for gallbladder disease is a low-fat diet. So you eat a low-fat diet and the pain goes away. Not always, but most of the time. Now you are in the category of asymptomatic. I've had patients come to me and say, well, what should I do? I've got these gallstones and I get pain every time I go out and eat greasy Chinese food. And by the way, my cholesterol is 335. And they wouldn't change their diet when their cholesterol is 335. So I say to them, you leave that gallbladder right where it is. That gallbladder will save your life. Every time you do something you're not supposed to do, it'll scream at you. You see, that gallbladder could be your friend in the long run. But sometimes you have to have the gallbladder removed, or often people have their gallbladder removed before they learn about a healthy diet. They just feel like this is something normal, natural with aging, which of course it isn't. Gallstones don't exist in populations that don't eat the American diet, not the kind that we have anyway. So you have your gallbladder removed. Now you got a problem, right? Now there's no place for that bile to be stored. There's no sac. So what happens is the liver makes the bile and it goes into the common bile duct and it gets to the small intestine, and because it makes so much of it, it drips into the small intestine when there's no food there. So there's now no food for it to mix up with, and so the bile drips into the small intestine, now down to the large intestine, and these bile acids are very irritating. So one of the common complaints people have after gallbladder surgery is they have chronic diarrhea. And the other thing that happens because these bile acids are so irritating is they have 4 times the risk of right-sided colon cancer. On the right side, the large intestine, right-sided, because of that drip, drip, drip of that irritating bile acid. So what do? Well, the gallbladder's gone. Nobody's going to give you a gallbladder transplant. It's gone. So what do? Well, you eat a low-fat diet because remember, bile acids are made as a result of the stimulation of the diet, because the purpose of bile is to digest fat. So if you eat a low-fat diet, you don't require so many bile acids, so the liver doesn't make so much. So it decreases the production of bile acids dramatically, and that same low-fat plant-based diet you're going to eat also is full of fiber. And dietary fiber mixes up with those bile acids and neutralizes them, so the diarrhea goes away immediately. And the risk of colon cancer dramatically decreases. Now, the pancreas has some problems related to the rich American diet, like type 1 diabetes. But the pancreas generally stays fairly healthy. Let's move along to the small intestine. Let's talk about the small intestine. The small intestine would go from the stomach all the way to the large intestine. The small intestine is very healthy. Most of the time, you don't see disease of the small intestine in people. Sometimes there's some autoimmune diseases like Crohn's disease or ulcerative colitis that can bother them. But generally, it's pretty solid organ. There are a few malabsorption problems that develop in very rare cases, but it's pretty tough. And I think the reason it's so tough is because through our evolution, through our development, or by divine purpose if you choose, what happens is it is necessary to have a very tough intestine. Throughout most of human history, there's not been very much food around. And those people who had disease of the small intestine, they're out of the picture. Their genes were gone because that's where you absorb all your nutrients, is in the small intestine. So if your intestine didn't work well, you just basically starved to death. So it had to stay healthy. In the small intestine is where all the vitamins, all the minerals, all the proteins, amino acids, fats, carbohydrates, everything is absorbed in that small intestine except for what cannot be absorbed, which we classify largely as dietary fiber. And dietary fiber, as you know, is really just like starch, except it has linkages between the sugars which can't be digested. We don't have enzymes to digest it, so these sugars, these carbohydrates, instead of breaking apart and going to form fuel, like they would in the form of starch that you eat, in the form of rice, corn, potatoes, and so on, what happens is the same foods contain branching chains of sugar that have linkages between them that you don't have enzymes to digest, so as a result, it flows intact through the intestinal tract. So let's go now through the small intestinal tract and let's get to the large intestine. The large intestine begins with the cecum. Attached to the cecum is a little tiny appendage. And that little tiny appendage is known as the appendix. It's on the right side of your body. And many people have appendicitis in our society. People are sometimes taught that appendicitis is due to little nuts and seeds getting stuck in the opening of the appendix, and that's how they get appendicitis. That's not true. What happens is the opening of the appendix, where it drains into the cecum, gets inflamed. It gets inflamed because of unhealthy contents that are in the large intestine and the small intestine, the cecum. It gets inflamed, and as a result of inflammation, it becomes edematous, swollen, and it closes down the fluids that are in the appendix because they're now static. They can't drain out. They get infected. And so you get appendicitis. In our country, we treat appendicitis by going in and cutting the appendix off. In European countries, they give antibiotics to treat appendicitis. I don't want to get into the discussion as to which is better, but just to give you an idea that clearly people know this is a disease of infection, inflammation of the appendix. I want to take a little diversion here and tell you about one of my heroes. I stand on the shoulders of many, many people who have known the things that I know and also have their own unique knowledge. And one of the most important people in my career I met during my last months of medical school. In medical school, I was very frustrated. I was frustrated because of the fact, well, I didn't know then why I was frustrated, but I can look back now and see what it is. I was frustrated because of the fact that I didn't see myself as a doctor. See, my picture of myself as a doctor was somebody that helped people. And as I was going through my training, I didn't see myself fitting into that role because I didn't see myself helping people. I found myself very frustrated. I would go to noontime medical conferences, and the doctors, the presenter, the lecturer would talk about various kinds of diseases, and what they would do is they would describe the disease, tell me about the symptoms and signs, talk about some genetic issues, some mysterious virus that might be involved, but nobody told me about the cause of the disease, the chronic diseases, or the cure of these problems. And I took these things very personal. I thought maybe I'm not getting the message, maybe I'm missing something here, maybe everybody else in the audience sees something I don't see. But I didn't really see a way to help my patients when I got out of training. And all that changed one day during my senior year, the last few months of medical school, when a visiting professor came to Grand Rapids, Michigan. And the purpose of his visit was to visit Kellogg Cereal Company in Battle Creek. And he wanted to go to Kellogg's Cereal Company and tell the cereal company that they needed to add more fiber to their cereals so that people would have less disease. This man had a very interesting history. He was trained in Edinburgh, Scotland, to be a surgeon. And as a surgeon trained in Scotland, he learned about how to take appendixes out, in other words, treat appendicitis. He learned how to treat diverticular disease. He learned how to treat heart attacks. He learned how to treat hemorrhoids. He was very good at treating hemorrhoids. He learned how to treat colon cancer, all kinds of common problems to Westerners. Well, when he finished his surgical training, he decided, along with some of his friends, to go to Africa and to work among Africans. And so he went to Uganda. And eventually he got a job as the head of the Ministries of Health of Uganda. And he stayed there for more than 10 years and took that position for more than 10 years. You may have heard about this man. His name is Dr. Dennis Burkitt. He's also referred to as the Fiber Man. Now, what he told me in that noontime conference changed my whole life. Instead of people telling me that they didn't know the cause of a problem or some kind of mystery, he said there is a cause of the problems of chronic disease that people have in our society. It's their diet. He says, the reason I know is this. He said, I saw all these diseases that you guys treat when I was in Scotland. But when I went to Uganda, I didn't see any. I saw no appendicitis in more than 10 years of serving there. I saw no diverticular disease. I saw no deep vein thrombosis. I saw no pulmonary embolism. I saw no colon cancer. I saw no hemorrhoids. There were no fat people. He said, I saw one heart attack. It was a judge who went to London, learned how to be a judge in London, and came back to Uganda and had a heart attack. It was the only heart attack he saw in more than 10 years. Let me take a minute and show you this man. I did an interview of him one time in the past, and I just happen to have that interview right here for you to see. Can we play the interview of Dr. Burkitt?
I went up to the medical school. I went up to the university in Dublin in 1929, deciding I'd do anything in the world except be a doctor or a dentist. And I entered the engineering school, and I did engineering for a year. And it was during my first year I felt very definitely called to give it up and take up medicine, and I have never, ever for one moment regretted that decision. I was a surgeon fundamentally for all my professional life, but over the last 20 years, just over, I switched entirely from trying to cure disease to go 100% into trying to prevent disease. Because it wasn't until I came back from 20 years surgical practice in Africa that I was helped largely by others to appreciate that most of the common chronic diseases filling the hospital beds in Western countries today are rare or unknown in the Third World, were rare even in North America before the First World War, are equally common in black and white Americans, and therefore they have to be due to our lifestyle, the way we live, and in which case they've got to be preventable if we can identify the factors in our lifestyle. To begin with, we talked about fiber, but then we realized we were far too blinkered. If you look at the diet of disease of the countries throughout the world who don't get the common diseases of Western culture, and when I say the common diseases, I mean diseases like atherosclerosis, diabetes, gallstones, bowel cancer, breast cancer, hemorrhoids, varicose veins, diverticular disease, huge pile of stuff. The countries who don't get these diseases have a diet with far more starch, far more fiber, far less fat, far less sugar, far less salt. And the two major things we need is to eat more fiber. The average American eats 15 grams a day. Our ancestors used to eat over 100. In much of the Third World, they eat over 100. The first thing would be to eat more fiber. The second thing would be to eat far more starch. Now, people are afraid of starch. They think starch is fattening. It's never fattening. More bread, more potatoes, more pasta, all those starchy foods, and more fiber and more starch. Then far less fat. I think that might almost come top of the list. We eat 45% of our total energy as fat, and it's nearly all saturated animal fat. I'd like to see. Now, peas and beans are extraordinarily good because they're high in soluble fiber, which is good from the point of view of diabetes and coronary heart disease. I think potatoes are very good. They're high in potassium. And Western man is the only mammal alive who eats more sodium than potassium. I think potatoes, as long as they are neither cooked or eaten with fat, are a slimming diet. They're very nutritious. They tell me that there's almost no other diet which contains almost everything a human being needs. I mean, vegetables and fruit are all good, but most fruit, of course, is 98% water, so you don't get a lot of fiber in it. But also, cereal is a good source of protein. I'm not a dietitian. I'm a surgeon who's coming by the back door, but this is just what I think about it.
When Dennis Burkett gave the presentation at our noontime conference, he showed a slide that I'll never forget. And all I can do is give you an example of this slide from my memory. What he showed is a slide with two frames on it. In one frame was pictured a small bowel movement along with a large hospital. And in the next frame was pictured a large bowel movement along with a tiny hospital. Do you get the message? In other words, if you eat a high fiber diet, which of course is going to cause you to have voluminous bowel function, then you're not going to be sick. If you're going to eat the American diet, which causes you to have very tiny rock-hard stools. In fact, I call them the rock-hard American fecal marble to give you some idea of what we're talking about. And I know you recognize this. Many of you recognize exactly what I'm saying. If that's what you're going to produce every 3 to 12 days, then the consequence is likely the rest of your health is going to reflect that. Now let's talk about fiber for just a minute. Fiber is the non-digestible part of the food. What happens is it goes through the intestinal tract intact. Do not think of dietary fiber as the bristles of a broom scratching your intestine. It does not do that. These are microscopic molecules. Maybe the way to think about it is think about a baked potato. Cook a potato thoroughly, put it in a glass of water, stir it up. You don't see anything scratchy like a broom, yet that's full of dietary fiber in there. This dietary fiber, it provides the bulk of the stool, not just for itself, but also drags water in. It also takes and attaches itself to bile acids and neutralizes them. It attaches itself to cancer-causing chemicals and neutralizes them. It's very important for your function to have lots of dietary fiber. And remember, there's no dietary fiber in animal products. Zero. Dietary fiber is only present in plants. So that's where you have to go to get your dietary fiber to have good bowel function. Now you eat this fiber-deficient American diet, and as a result you develop these tiny little rock-hard stools. Those little rock-hard stools, they form in the large intestine as water is taken out of the material that's left. Well, when you eat the American diet, there's not much material left. You have in your diet maybe 8 grams, 10 grams, 15 grams of dietary fiber. Whereas on a healthy diet like the one that we're sharing with you, you may eat 80, 100, maybe even 140 grams of dietary fiber a day. So when you eat a diet that's very low in fiber, everything gets absorbed in your small intestine. All the vitamins and minerals and fats and proteins and carbohydrates that are digestible all get absorbed. There's nothing left. So it forms this little tiny rock-hard American fecal marble. Now you've got to move it along the intestinal tract. And in the process of moving along the intestinal tract, what happens is you create high pressures. There's a law of physics called the law of Laplace. The law of Laplace says if you contract an organ like the intestine at small diameters, you create very high pressures. If you contract at large diameters to get the same kind of movement, you contract at small pressures. Now, the large amount of pressure that's created by trying to move along this tiny little rock-hard fecal marble, from one part of the intestinal tract, the beginning to the end, it creates pressures that cause damage to your intestinal tract, particularly the intestinal walls. What happens is little balloons are blown out the side of the walls, and we call these little balloons diverticuli. And I want you to notice, if we look at a close-up section of this picture, where these diverticuli form. The way the circulation of the bowel is the intestine is supplied by blood vessels that come from the aorta. These blood vessels go to the large intestine across the outer surface, and then they dive through the muscular wall of the intestinal tract, and in that way they supply the inner surface of the intestinal tract. Well, where they dive through the wall is the weakest part of the intestinal tract. So that's where the diverticuli occur, in that weakest part of the intestinal tract. And so you get these balloons blowing out there, right next to the blood vessel. And that explains one of the common symptoms of diverticular disease, which is bleeding. The bleeding is often microscopic, but it can get very serious. I can remember being in on operations where the only way we could save the patient's life was to cut out a section of their large intestine to stop the bleeding. Those pouches, those diverticuli that are blowing out, they look a lot like an appendix. And they can get infected like an appendix too. The opening can be closed down, not by a poppy seed, not by a strawberry seed, not by a nut, as somebody's trying to tell you, you might have heard. That's not what happens. What happens is when you eat an unhealthy diet that has unhealthy remnants that form that unhealthy stool, it becomes very irritating to the opening of that diverticuli, and it gets swollen, closes down, fluid accumulates, it gets infected, you get diverticulitis, which we also call left-sided appendicitis, because it's just like right-sided real appendicitis, it just occurs on the left side. The nice thing is if you eat a healthy diet, what will happen is you will stop the bleeding. Diverticuli will not go away. Those are permanent structures. You will stop episodes of bleeding. You'll stop getting diverticulitis by changing to a high-fiber, low-fat, healthy plant-based diet. All right, we put all this effort to moving that tiny little rock-hard American stool all the way through the intestinal tract. Now we have it at the end of the intestinal tract. Now we have to get the stool to see fresh air. How do we do that? With great effort, I tell you, with great effort. Children tell you the darndest things. I remember my two young kids. They were, about 10 years old, and they just spent the night at Mark and Jody's house. And we're sitting at the dinner table where these kinds of conversations occur. We're sitting at the dinner table, and my daughter says, "You know, I think there's something wrong with Jody." Let me tell you what happens. She goes in the bathroom. She's there forever. And I hear these really strange noises. "Well, like what?" I said. "Well, like, And my son says, "You know, Mark, same thing happens, makes the same noise. What's wrong with those kids?" See, my children never knew about that. For my children, they're out playing. They got the urge, ran into the bathroom. 30 seconds later, they're back out playing again. That's the way it's supposed to be. You have to put tremendous effort, and you know exactly what I'm talking about, into moving that stool through its last few inches. Now think about the person sitting on the toilet, and they're grunting and groaning, and what does their face look like? It's red and looks like blood has been pushed up into their face because they're putting so much effort into it. Well, that blood just doesn't get pushed into the face. It gets pushed all over the body with great force. And as a consequence, what happens is blood gets pushed into blood vessels that are damaged. Some of those blood vessels that you are familiar with that get damaged are the ones in the last part of the large intestine. There's a series of blood vessels that form cushions in the last part of your large intestine. The purpose is to prevent leakage at inopportune times of gas and stool. These are called the hemorrhoidal veins. Now, when you eat the rich Western diet and you have to put this kind of effort, once every 1 to 3 or 12 days into moving this bowel movement, you create such tremendous forces that you engorge these blood vessels with blood, make them dilate permanently and damage them, and they eventually end up hanging out the bottom of the intestinal tract. And we call those hemorrhoids. You don't get hemorrhoids from sitting on cold seats. You get hemorrhoids from eating an unhealthy diet. Remember, Dr. Dennis Burkitt never saw hemorrhoids in his population of African people. Now, to complete the picture of hemorrhoids, what you do is you actually end up everting the muscle at the last part of the large intestine. So actually part of that last part of the intestine lies on the outer surfaces of the body. Those hemorrhoids are not going to go away. They're permanent structures. Generally, you should just leave them alone. If you eat a healthy diet, then they'll stop bleeding, they'll stop itching, they'll stop causing you problems. But if it still is a difficulty, a problem for you, then you'll have to go see the surgeon. and have them removed. But usually just a change in diet will make them tolerable enough and make them not give you any trouble. You could just leave them alone. Let's get back to the straining. You strain, you grunt and groan, you're moving blood all over the body, pushing it with great force. Well, what happens is you end up pushing blood into the blood vessels in your legs. Now, your legs are made with blood vessels that are quite long. As a matter of fact, the blood vessel goes all the way from the bottom of your foot all the way up to your heart. In other words, it could be 4 or 5 feet long. And a column of blood uninterrupted 5 feet tall would create tremendous pressures because of gravity on the foot. So the way the body is designed is this has valves in these blood vessels. These are one-way valves. They open in one direction, flap down, open and flap, open, flap. So as you walk along, what happens is your muscles contract, the blood is forced up, and the valve closes down so the blood can't leak back down toward your foot. And that's the way the blood moves in a step-like manner up to your heart. When you grunt and groan and strain to move this tiny little rock-hard stool, what happens is you put pressure, abnormal, damaging pressure on these leg veins, and you dilate the veins. The valves become incompetent. Now you've got tremendous pressure on the veins. They become large and worm-like. And what do we call those? Yeah, varicose veins. That's how you get varicose veins. Other problems occur when people put this kind of straining on their body. For example, women. The uterus is suspended by ligaments. Through the pressure that is created to move the bowel movement, the abnormal pressure because of the American diet, what happens is you end up pushing that uterus with great force, and you stretch out those ligaments that originally suspended your uterus in its natural position, and you push it into the vagina. And you get a prolapsed uterus, and sometimes this can end up with a uterus that actually lies outside of the body. It can be a very distressing thing. You can have it resuspended, or often women have a hysterectomy. But wouldn't it be better to prevent that complication? With men, with the straining, they'll cause varicose veins in their scrotum area and their testicle area. And that, again, is due to the abnormal straining that occurs. When you make this little tiny rock-hard American stool, what happens? You have to cause tremendous forces that affect other parts of the body. For example, what you have to do is you put strain and pressure and force on the abdomen. And what happens there is the abdomen actually pushes the stomach from its normal location up into the chest. Now there's a muscle that separates the chest from the abdomen. It's called the diaphragm. And through the diaphragm pass 3 structures. Passes the aorta, the vena cava, which are fixed. They can't move. And it passes one movable structure, and that movable structure is the esophagus. And because it's movable, when you put that strain, that force in there to try and move your bowels, you take and you push the stomach up into the natural hole that occurs in the diaphragm through which the esophagus passes. And you actually force the stomach into that hole, you dilate that hole. And a dilated muscle is called a hernia. And the consequence is you have a hiatus or hiatal hernia, which affects over half the people in Western societies. Now, as a result of having this hiatal hernia, you run into some problems. Every time you take a breath, because now part of the stomach is up into the chest, you take in, you create negative pressures, and you suck acid up into your esophagus. But one of the biggest problems here has to do with that lower esophageal sphincter that I was talking about at the beginning of this talk. I told you that sphincter closes down between your meals. But what happens after eating the rich Western diet for years, you end up destroying the competence of that sphincter, and now it doesn't stay closed between meals, and now acid can leak up into the esophagus and into the rest of the upper intestinal or upper respiratory system. One of the reasons it doesn't work well is because its normal position, normal anatomical position has been displaced. Usually that sphincter is positioned right at the diaphragm, right at the hole where it goes through. And so it gets support from the muscles of the diaphragm. And so as a result of having this support, the sphincter is able to function properly. When you move the sphincter out of that normal position located right at the diaphragm, you move it up into the chest, it doesn't have support anymore. So now it's not competent. And as a result, it leaks that acid up into your esophagus. You can deal with this in several ways. One thing you could do is you could start eating a healthy diet. And then the heartburn, indigestion you get especially when you bend over, becomes much less of a problem. In fact, will probably completely disappear just by changing your diet. As a last resort, you can hire a surgeon to go in there and cut your chest open, and they can take that esophagus and pull it back down into the normal position in the diaphragm and take and sew that hole up tight like they do with a regular hernia and do a surgical repair. But you don't want to do that. I mean, that's the last thing that you want to do. So there's a multitude of problems that people suffer from due to the fact that they're constipated. They have tiny stools. This is not just an inconvenience or an embarrassment. This results in serious diseases that can threaten your life and certainly can spoil your whole day. And remember where the sulfur comes from. The sulfur comes from the animal products. Beef has 4 times more sulfur than beans. Eggs 4 times more than corn. Cheddar cheese 5 times more than white potatoes. Chicken 7 times more than rice. And tuna 12 times more sulfur than sweet potatoes. So you want to improve your body odor from one end to the other. You do it by simply changing your diet. Thank you very much.
Okay, the potatoes are done. I don't know if you can tell, but they're golden crispy, so good. Some of the edges, around the edges, might have gotten a little bit overcooked, but they're still good, even a little bit crunchier. So I'll put the thicker pieces in my bowl that I'm going to take with me to work, and I'll put the thinner ones that Brenda likes in her bowl. She works from home, and I'll split these up. These golden yellow potatoes with any kind of oat flour, chickpea flour, any kind of flour you can put on it, plus nutritional yeast, they are so good right out of the oven. It's amazing. You've got to try this. So my sweet potatoes, as you know, I boil all the potatoes once and then I put them in the fridge. But my sweet potatoes, I then bake and then put in the fridge again. I bake them at 500 degrees for 30 minutes. And the golden yellow potatoes, I don't bake a second time like I do the sweet potatoes. They don't hold up as well as the sweet potatoes do. So then the next day, I put them in the fridge again, then the next day, that's when I slice the golden yellow potatoes and I slice the sweet potatoes. So the sweet potatoes have now been cooked and baked once. Now I'm going to bake them again. The golden yellow potatoes, I've boiled them once and I'm going to now bake them. And so the reason that I'm cooking and cooling these potatoes is because they have starch in them. And any starch that you cook and cool forms resistant starch, even rice and beans, obviously potatoes. And this resistant starch is a harder product to process by your GI tract. And the upper GI tract can't process it, so it has to put it into the colon. Well, in your colon is where your good bacteria resides, and it loves resistant starch. It loves feeding on resistant starch and fiber. And those are some of the things that meat and dairy don't have. But beans and rice and potatoes all have it, especially if you cook and cool it and it becomes more resistant starch. And then your microbiome feeds on that and is healthy. And 90% of our serotonin is made from the gut. And so you want to feed it a lot of fiber. And that's why this whole food, plant-based diet is so healthy for people, is because it's not just physically healthy, it's also mentally healthy for you. So I just want to encourage you to try this at home. I hope you'll hit the like button and also the subscription button so you know when I come out with new videos. And I'd just like to invite you to join me in eating whole food, plant-based.